Thanks for joining us here on PM Express. It's a big conversation. This is the dialysis crisis that we've been talking about. We've been on the campaign for a while. And there was a major announcement by the MPP presidential candidate and the Vice President, Dr. Baumia, that treatment is going to be free. And this is why this is interesting. In the context of the elections, which is now some 26 days away, we thought we should pause and look at this because as we have already told you when we did the health manifesto, the MPP and the NDC both had promises around this. The NDC wanted to do this if they win next year, and the MPP also wanted to do this if they win next year. Both parties wanted to do this if they win next year. Then we see that the MPP seem to have undercut everybody, all of a sudden saying they will do it now. And this is just a few days away for implementation. The Vice President making the point there that starting December 1, treatment for kidney diseases as far as dialysis is concerned, the renal care will be free. And this is not free half, completely free. So if you need 8 sessions a month, he says you get the entire 8 sessions for free, monthly, which is going to cost us a fair bit. But the interesting point is, it is in their manifesto, but it wasn't programmed for implementation this year. But he now says, he announced first, that it is going to happen this year. If you are one of those patients struggling right now with renal disease and you are on dialysis, this is a lifesaver. But there are fundamental questions that you still need to ask, just to be sure that we can actually support this, as in the National Health Insurance Authority and the scheme can support this. And this is what I'm talking about. This is the NPP's promise, and this is the NDC's promise. The NPP's promise is very clear. They wanted to extend the National Health Insurance scheme to cover dialysis treatment, right? But this is for 2025 and beyond. They didn't actually tell us when next year they will implement this. And then you have the NDC with a very similar one, but they wanted to put it within under the big umbrella of what they call the Ghana Medical Care Trust Fund, which will take care of chronic diseases, including dialysis treatment. And that, by the way, was the NDC. And we know this was a big deal. It became one of the most topical issues last year. We did a thought leadership event on it. The government had to respond to it. It was one of those things that moved people on an emotional level. And so there are votes at stake, but most importantly, there are lives at stake. There are many people who can't wait till next year to do it. And so if the government can find money, they'll save lives, but maybe they'll win votes too. You need to ask the question, was the votes part of the consideration? But does it even matter? But they're doing it now. We know that they did a pilot, right? The pilot has ended, and it is on the back of the pilot that they are going to be implementing this on the full scale. When they did a pilot, if you're between 18 years and above 60 years, you got the 8 sessions for free, right? If you're 19 years and below 59 years, you will get 2 dialysis sessions for free. So this was on a limited scale, what they did there. And then the cost there was something around 4.4 million. This is something that definitely the National Health Insurance Scheme should be able to bear, which they did. And if you're looking at it in terms of how much they paid so far, because the hospitals will have to foot the bill at the start, and that is how the NHIS operate, and then the NHIS will have to reimburse. As of the last statement that the National Health Insurance Authority put out, they've paid 1.58 million paid as of August. We don't know if they paid more than that, but they had to pay all this to the hospitals who are taking care of the patients because the government said they would indeed cover it. Now, the question we need to ask is 4.4 million that was spent in the pilot, how much of that have been paid so far to date? They should have cleared this by now. If they haven't, it raises questions about if you haven't cleared 4.4, can you clear what it would take to do everything, right? Everybody who currently is on dialysis will be catered for. And this is the breakdown that we're looking at, because we're looking at 400 patients. How do we come to 400 patients? According to the National Health Insurance Authority boss who spoke to us today, the pilot they use 400 people because that's the number they got from the association. We'll look at that when we sit down for this clarity. How many members of the the Renal Patients Association, how many members are there? But they're using 400. But he also said something interesting, that even if it's 600 and you double that number, because if you make it free, more people will show up, they still have the funds to take care of them under this new arrangement where dialysis is not going to be covered at the National Health Insurance Scheme. But let's work with the 400 that he put out. If you're doing that and you're using cost per session as approved by Parliament of 491 CDs, and remember, the private health facilities will charge significantly more than this, but this is what you're using because that is what the Parliament approved. You're talking about some 1.57 million CDs a month. In a year, you're talking about 18.84 million, right? Again, if you look at the numbers involved, it isn't something that government should struggle with because government should be able to pay for this using the NHIS because the NHIS has done really well in terms of how much funds it's been able to bring in over the years. And you see it's been on an upward trajectory, hitting its highest yet of 7.6 billion cedis in terms of the revenues coming in from the National Health Insurance Levy. We are paying for this. So if you're getting 7.6 billion cedis there, this should be something that we should be able to bear. That here. It should be something that we should be able to bear. If it only is around 18 million cedis a year, we should be able to bear that, considering that we are making 7.6 billion cedis from the taxes that we pay into the National Health Insurance Scheme as contributors as far as the levy is concerned. So this should be easy for the government. And you wonder why didn't they do it before and why was it such a big deal? But that is what the numbers tell us. And we know that in addition to the levies you're paying, in the budget, government gave them some 6.87 billion. There's a lot that the National Health Insurance Scheme is doing. And from the authorities' point of view, this, they will tell you, is not adequate because part of this is also capped. And if you uncap it, there'll be more money available. NDC says they will uncap it, right? But the MPP haven't quite clarified on that particular subject, but there's a lot of money in the kitty to look for and to fix it. So let's have the conversation. Let's break this down a bit more. What would this mean for you, right? If you are on dialysis right now listening to us, I'm pretty sure you have questions. The association's president is here with me. He will ask us questions. We'll be speaking to the government special advisor on health. Dr. Nsiasari is my guest. We need to get the questions answered because the 1st of December is just a few weeks away. Lives are at stake. What would this mean for you? Where can you go and access that particular care? All here on PM Express right after this. And thanks for staying with us here on PM Express. It is strong, it is tough, and that is Syntex Tanks. We also have Academic Times. You also support PM Express and Pepsodent Cavity Fighter toothpaste. And Academic Times is Ghana is an incoming graphic and online publication aiming to collaborate with university authorities and students to ensure that student research is published in summary form. And then you have Syntex Tanks, where I know you know that Ghana is getting ready for the biggest giveaway from Syntex Tank. Syntex is visiting 15 communities, giving them free water. And this is to say thank you, Ghana, for making us the #1 tank brand in Ghana. Now, if you are a community and you want to benefit from the Syntex free water giveaway, just log on to their social media handles at Syntex Ghana and nominate your community. Syntex Tanks, are you strong, are you tough? And then Pepsodent Cavity Fighter, toothpaste every time we eat food and sugars are trapped between our teeth, leading to tooth decay, gum disease, and in some cases, foul breath. Brushing your teeth every morning and night with Pepsodent Cavity Fighter gives you your teeth that protection they need, and you need to really get one tonight. My guest joining me for a conversation tonight is the Presidential Special Advisor on Health, Dr. Nsiasari is my guest. Dr. Anthony Nsiasari is my guest. He's the Presidential Advisor on Health. Bafo Kojo Ahinkra is the President of the Renal Patients Association of Ghana. I'm also joined by Dr. Kwame Saponasiru. You remember him. He was with us on the show just last couple of weeks talking about the Health Manifesto. I'm delighted that he can join me again because there's a lot more we can interrogate on this particular subject. Thank you very much. And Secretary will join me pretty shortly. We need him to explain to us a bit more so we can understand, I mean, the policy and the costing of this. But Mr. Hinkra, let me bring you in quickly. From what we heard today, this policy rollout, they had consulted the association.
Yes, because it was part of the committees when we sat down, I think, way back, I think, around, is in May, I've forgotten the date, before they brought in the 16 below 18 and then the 60 above. It was something that we discussed. So
before the pilot?
Yeah, before the pilot. A committee was set up, which I was part of the committee. Dr. Nsia Asare was the chairman for that committee. So we put all these things into. So it was decided that let's start with the pilot and let's see how it is go, so that they can bring in the free dialysis system that we are now hearing, because they just wanted to look at the numbers. That's what they wanted to do. And I think, per what we saw, the numbers were not that scary that they were looking at. And it was something I keep telling it, because when you take the data that the people who come to the hospital, kidney, we are in Ghana. Some people are saying, Yabudia. Some people are saying they want to do herba. So the data that we have is basically on those people who come to the hospital. Yes, so that is, so the numbers are not that scary. So this is something that we were even expecting for a very long time, because it was part of the discussion that we took at the committee level.
So how many patients did you give them? Because I listened to the National Health Insurance Authority boss today, and it says when they work with you, you give them 400 patients. That's in your members.
Yes.
400.
Yes.
Okay, so that's a number that you're working with.
Yes.
And you're certain that if one is to make free completely for everybody, that won't be exceeded. That number will be exceeded.
Yeah, it will, because
it will be, okay.
Most of the people are not coming to the hospital because of the money.
Okay.
So, and then a lot of them too, instead of the normal 3 or 2 sessions, are doing 1. So if now this rollout is coming out, then they have their health insurance. They'll be compelled to come to the hospital regular. So definitely then the 400 will exceed, it will go up. And I think they factor all those things into it. Because, yeah, I remember we doubled the numbers when we're doing the actuals to see how it will go. And we realized that they still can do something about it. Yes, so we did.
So let's take 400 to be the lower limit of numbers.
Okay.
In terms of your patients.
Okay.
Knowing what you know across the country, you've been speaking to your members, what could possibly be the upper limit that we could possibly be working with if the roll is out from the December 1? How high can it go? I've heard the NHI boss say even if it goes to 600 people, they can work with.
Sure.
Even if it double that, they should be able to still find the numbers.
Yes.
The amount to work with.
Yes.
I mean, we'll use the calculation of 400, which you give them. We are right of the 18 million.
Yeah.
If you do 800 of that, that is times 2. That's very close to 40 million CDs a year. That shouldn't be a problem.
Yes. Yes, that shouldn't be a problem, because once again, as you are doing your term, you could see the national health insurance is being capped.
Yeah.
Yes. So I'm also thinking maybe they look at they want to take the cap off, because if they take the cap off and the money does not go to the consolidated fund and it will be given to the national health insurance, they can even do more than the 800. They can even do more than the 800 because it's being capped. And then at the end of the year or every month, the Ministry of Finance just will give them some check of some amount of money. So if now, I think they've considered all those things, because it was part of the discussion that we were doing, that they should take the cap off.
But this will only be for the public hospitals.
Yes.
Where you have dialysis treatment.
Yes. Because
this initiative.
Yes, as we were doing it, we were looking at the government hospital.
And so again, they would all be implementing the fee as approved by Parliament.
Parliament,
okay.
Yes.
Stay with me. Thankfully, the Nsia Asare is with me he joins me right now. Dr. Nsia Asare, thank you very much for your time here on PM Express. I mean, this was something that was in the manifesto, and when we did the manifesto tracker the last time with Kwame Separation, we talked about this. And then now we're hearing, Bami announcing just a few days back that this is now going to be implemented starting December 1. What changed, though?
Yeah, good evening to your viewers and listeners. Remember, in June this year, there was a committee which was set up by the National Health Insurance Authority, which I happen to be the chairperson of the committee. We look at the number of people who are on dialysis. You see, dialysis is one of the modes of treatment. I'll call it, it's a stopgap treatment for chronic renal failure patients. Mm-hmm. So we look at the totality and how the burden is and what is happening across the country, the number of people who are on dialysis in the 4 major centers in the country. You know, most of the patients go to other Kolegu, Konfanochi, Ifie Kwanta Hospital, and I think
Cape Coast?
Whole Teaching Hospital and then Cape Coast Teaching Hospital. So we look at these centers. And as you rightly said, I heard you saying that there are some few people who also go to the private institutions. And then there are also other hospitals like Bank Hospital, and I think EGMC also have maybe a dialysis center. So we thought of the vulnerable group that time. In cases of such nature, we look at the vulnerable group, which are children below the age of 18 and also adults above the age of 60. And the health insurance said that they have a social corporate responsibility fund, which they can use and also give 2 sessions of dialysis per month. And they were looking at up to the end of December, and then they will see the way forward. If you look at our manifesto, we have put in a holistic approach to chronic diseases, including chronic renal failure. You know, dialysis is one of the treatment or stop treatment in chronic renal failure patients. The most important thing is that we put people on dialysis to prepare them to receive kidney transplant. So we look at how do we prevent and promote health and also early detect, treat patients who have leading causes of dialysis. So we have realized that one of the 2 major causes of diseases of dialysis is leading to chronic renal failure, hypertension, diabetes, or combination of them. So once you start doing what health insurance have now introduced, which is 1 free medical check a year, which I call it adult way, especially for adults. Whether they are sick or not, they have to go and check themselves. Those who are health insurance we can then diagnose them early enough. Those who are not hypertensive, the actual causes will also be taken through health promotion to live healthy lifestyles.
And I know that's a big picture, but for those who really want to understand the new policy, let's break it down a bit more. So first of all, what cost were you using to calculate this in terms of what you're catering for from the December 1, and where can people go to get that treatment for free?
Yes, once you say that health insurance will take care, it means that health insurance is going to continue with what started on the 1st of July 2024. And now they are adding all dialysis patients. And you're talking to the president of the Dialysis Patients Association, and he was giving a figure of those that he knew, I think about 400, and you were asked if they are 800. He said yes. If you are charging about 490 Ghana cedis,
91
section, with a minimum of 2 sections. Some of them have a maximum. Some of them even go to about 4 sections. Those who are very ill, or 3 sections averagely. Then the health insurance will take care of those people till they have some other means of treatment like a renal transplant. And I was saying something, but you didn't allow me to finish. So what we are looking, which we have put in our manifesto, there is a policy on tissue and organ donation, storage, and transplantation.
Yeah, in fact, the reason why I didn't allow it, but I'll spend some time there because that's a whole policy that we need to sort of unpack. Because it ties into this, I know, but I want to just break down this policy first. I mean, from your end, because you chair this, and I also have the ear of the president, in terms of budgeting, how much do you estimate this is going to cost us a year to cater for every person who has dialysis in this country?
Yeah, so if you take 490, and I think the average that they are giving them is 2 sections, if I'm correct, per month. So for 1 year, if it's 2 sections, it means it's about 24 sections a year, times 490. And if you have an average about 400 or 600 patients who are on dialysis, then you multiply the 490 times 2, is 600 people. That is the cost that life insurance will bear in a year.
Okay, and there's a possibility that the numbers that you're working with will increase significantly now that it's completely free, right? I mean, so has that been factored into the budget?
Yeah, that has been factored in. So the numbers, I think, on dialysis, if you are taking up, so you see the figure that you used during the time that I chaired that committee was about 400. I think the president was talking about that.
Yeah.
If we add 200 to, that's why I say about 600 before more people join. But we are hoping that with the annual checks that we are doing, we will prevent a lot of people getting into chronic renal failure by diagnosing them early, the causes of chronic renal failure, so that we mitigate and reduce the bed. Okay. That is what we are going to do.
The sustainability of this new policy comes down to financing, right? Let me ask, the piloting phase, we were told it was going to cost us 4.4 million cedis. Have we paid all that we owe to the dialysis centers across the country?
As I know, yes, all those who have brought their bills have been paid. That's what the National Health Insurance Authority told me.
Okay, and you are up to date as far as you presented your bill, you have been paid already?
Paid, yes.
Okay, please stay with me. Yeah, please go on, sorry.
Yeah, once they present their bills, they are paid. You know, if you present a bill to health insurance, they have to check it and make sure that everything is correct. And the National Health Insurance Authority CEO told me.
Okay, good. Kwame Sapansiru, this is definitely good news for a lot of people, including Mr. Hinkra here with me in the studio. It comes down to whether we have the funds to sustain this. From everything I've heard and the calculations and the numbers involved, and the amount of money you're raising from the NHI, if you uncap it in addition, this shouldn't be a problem, should it?
Thanks, Evans, and good evening to my fellow panelists. If you remember from October last year, when we first had a discussion on dialysis, I said this was affordable. I was very categorical in saying this was affordable, and that there was no reason why there should be a delay, because delaying was going to lead to loss of life. I did further say that I had not seen any country in the world where renal dialysis was paid for by the patient, because it would definitely bankrupt you. And therefore, it's always funded by insurance. So I'm glad that it's being funded at this point in time. My concern is the timing of the others. And I have no question that it's affordable. Let me state that as well, because you need to look at these things from the numbers. And the prevalence rate of renal dialysis requirement in Ghana is about 39 patients per million. So if you look at it, the maximum we can get to is about 1,315 patients a year on renal dialysis, even though end-stage chronic renal failure prevalence rate is about 13%. But those who would be on dialysis, like Dr. Nsiah has said, which is a stopgap measure, would be only 39 per million people. So if you do the calculation, it comes to about 15,360. Of that, not all of them are accessing service, because unfortunately we have health-seeking behaviors where people would go to other forms of health-seeking, sometimes even informal health-seeking, like prayer centers and all that, without even knowing that it's chronic renal failure. So there are a lot of them who work. So if you look at the true numbers that would access service, based on the 1,350, you are talking about 800 to 900 people. And it was on that basis that when they did a calculation and excluded the not at-risk patients, they were talking about 400 patients requiring it for the pilot. And if you look at the data that has come from the National Health Service, you'd realize that in actual fact, they were not, they didn't even get up to the 400 patients a month. They were getting up to 350 because of our health seeking behavior. So on that basis, and considering that now that National Health is going to take care of it in totality, it means private health providers who are providing dialysis to their patients, who are National Health providers, are going to get their payment from the National Health Insurance Scheme. So the numbers.
But the private guys don't charge the same amount, do they? They don't charge the 491.
Well, yes. So then you are talking here about what's called co-payment. But then it's still going to give those seeking private health dialysis an opportunity, because they're part of whatever session they go for will be paid for by the government. So that's a good thing. And the other thing is, now that it's insurance paid, perhaps they could have further negotiations with the private providers so that they could have a funding facility going to the private providers. Because what I know is that with the government hospitals, actually, they actually pre-finance, the National Health Insurance as part of the pilot pre-finance, and then we're checking. So some even facilities haven't been able to use the entire complement of what they were paid for, which is a good thing. But that's going to change now that the announcement has been made, because more people are going to access it. Again, I go back to the timing. Why have we left it 1 year after all the actual statistics from the time in October when we had the initial conversation hasn't changed? The numbers have been between 34 and 39 per million since I made that declaration and said, based on the National Health Insurance collectibles, they could fund it. And that for me is the question that needs to be answered.
But what the answer isn't the answer in the pilot, because to roll it out fully, you want to first test it with the pilot, and the pilot just ended, and now they can now say, based on the experience on the pilot, we can expand it and cover everybody.
Yeah, and I take that on board, and that's why I said that's what needs to be answered. So in answering it, you need to put the data out for the pilot to say, we're not sure we could fund it. These are the data for the pilot and all. To be able to allay the concerns of people who might have negative skepticism about whether this is feasible or not. But if I look at the numbers from where I sit, it is more than adequate for this to be funded. Because if it's not, then the health insurance and the country is not a country worth dying for.
And Dr. Mensah, sorry, so another key area of this is the private health facilities who also offer dialysis treatment. Well, what happens to them under this arrangement from December 1?
Yeah, we will look at the number of people who are going to the private health institution, how much they are charging. It's all very important, because this is a government policy, and if government is giving that money, as Dr. Asiedu said, if somebody decides to go to the private health facility, and the health facility is charging more than what health insurance is paying for the government institutions, then co-payment comes in. And I'm very sure that most of these patients will also be coming to the public health facility, because that is more cheaper, and those who can afford and can pay can go to the private health institutions. So we look at all those things as we unfold the policy.
Okay,
so it's early days.
Okay, so you're going to do an assessment of the private health facilities and what they charge. Does that mean that once that is done, you may cover those who go to private health facilities for dialysis treatment?
Yeah, they are all Ghanaians. So we are giving this to Ghanaians who are having chronic renal failure.
But they won't charge your base rate of 491 cedis.
Yeah, then it means maybe it will be a co-payment for anybody who decides to do that. It's also done in a lot of places.
Now, the NHI, from what I understand, you have an annual budget and you do a plan of what you want to spend your money on for the year. When the year started, covering dialysis treatment wasn't part of the budget. In fact, when you were doing the pilot, you used what had already been approved for the corporate social responsibility. Now that you're beginning December 1. You haven't planned for it in the NHIS budget necessarily. How do you bridge that gap? It wasn't part of the annual plan, an annual budget.
You remember that when Kwame Sidi was talking, he said that the number that National Health Insurance even budgeted for is we are not using all the money for that now because we are getting less than 400 people. Mm-hmm. That means that they've made some savings. And we have only 1 month in this year's budget. That's only December. So I'm sure they will have enough savings to cater for the month of December. And as we move to next year, new budget season starts and it will be covered adequately in the budget.
Okay. Now, you have raised the issue that, yes, it's a good promise. It was made on a political platform by the Vice President. And if only the government will keep its word, this is life-saving.
Yes, government keeps its word. You remember when we said we are going to give it a free dialysis to the vulnerable group that is below 0 to 18, and also the above 60, and 2 sections for the patients between the age of 18 plus to 59. Government kept its word. And we have paid so far, we've looked after them till today. Our government will do the same thing after those that we have. We promise, we don't fail when we promise. Okay. We know what we are standing on. We know what goes into it. We've thought about it adequately. And as I said, apart from that, moving into the next year, God willing, when Ghanaians give us a chance to rule this country again, we put up a comprehensive policy plan so that we can take care of all chronic diseases, including chronic renal failure.
In fact, that question I asked was to Mr. Henkra, but since you've touched on it, let me ask you directly. How significant was the elections and the need to win it part of the consideration to roll it out from December 1?
I don't understand what you...
I mean, the question is very simple. I mean, we're going into an election. You have to win elections. The Baumia said it on the campaign platform. Was politics and the need to win votes part of the consideration to introduce this policy from December 1?
Oh, it's a need to save Ghanaians. That was the consideration, not to win votes. After all, it's not everybody who needs dialysis in this country. The number of people who have chronic renal failure on dialysis is a very stable number of people in the country. So if it really votes alone, we say that, oh, there are only very few of them, so let's leave them aside. But our government, the NPP government, and my government, and your government, thinks about the people, the health of the people. And that is the reason why he made that statement, I think 2 days ago. It's not about winning votes. It is about thinking about the health of the people of this country, thinking about the poor and the vulnerable, and making sure that dialysis patients also have a relief. You know that, Evans, when you are a dialysis patient, a chronic renal failure patient on dialysis, and you're on dialysis for about 10 years, 5 to 10 years, even if you're a billionaire, you become a pauper. And you can ask Mr. Henkra, he will tell you what they go through every day. Because you're on dialysis, you are sick, whatever you are doing, you cannot do it again. You have to spend all your money on making sure that you are alive. That's where you see that if you're a government in power or a government who is ruling the country, you have to think about them and make sure that people don't get into renal failure to go through that system and they get the best quality treatment that they should have as a people in this country. That's exactly what His Excellency Dr. Alhaji Mahmoud Bawumia did, and not necessarily about winning votes. After all, as you said, maximum they are about maybe those who benefit from it now. Now, those who are benefiting about less than 400, if you even double it or even triple it, it's 1,200. And that, to me, is not why he said it. It's not political. It's the empathy that he has on the people of this country. And as a government, irrespective of elections, we have to make sure that the people of this country have some relief.
And that's an assurance to you that this is not about politics and they want to do it.
Yes, that's what I was saying. As part of the committee, I was a member of the committee. These things were discussed. we discuss it because, like we were saying, we saw the numbers. We just realized that something could have done, but then we just wanted to see how the pilot will go. Like we were saying, the pilot was supposed to do 400, and per the statistics, we were not even getting there. So for me, I knew something good was coming because I was part of the committee and I knew what was in place.
How much of a difference will this make to you?
A whole lot of difference. Evans, I've been on dialysis for 10 years.
10 years?
Yes. I've been on that. So I sit here, I had nothing. I don't even have one cent in my account. Between me and you, today, I went for a session. I didn't pay. Not that I didn't pay, I didn't have it. I have to go and tell them this. Let me go through. I'll go and look for money and come and pay them later, probably on my next session. So if this thing is coming, it's a big relief. And not me alone. Just last week, we lost 3 people. Probably if maybe this could have come a bit earlier, the relief alone could have kept them alive. Because you go, you are just thinking of your next session. Where are you going to find the money? And you see, even the government owned, that's why we are paying the 491. The private, some are charging 800,000 per session. So you can imagine. So it's a big relief. To me, it's a whole lot of, like maybe today I will sleep well. Because I know if I'm able to manage myself through the 1st December, when I get, I just have to pick my card and just go to the hospital and dialyze. Maybe I can live maybe another 10 more years in my life if you take good care of yourself. So it's a big relief. Like Dr. Mensah just said, I hope and believe it's not politics. I hope and believe it's not politics because I was part of when we did the discussion. I was always fighting Dr. Mensah. Sometimes when we finish, I said, Doc, today I don't have money. Give me money to go and do session. And he'll give me. And I'll go. I always fight him, Doc, let's do this, let's do this. So eventually, it was something we were expecting. Only just the time, we didn't know when it was going to come. So it's something we were really expecting. So we thank Dr. Baumia and Dr. Mensah for, it's long overdue, but eventually we are there now. We thank them and we really appreciate what they've done for us.
So let me ask you, you said that you've been on dialysis for 10 years.
Yes.
But dialysis is supposed to be a stopgap measure.
Yes.
Allow you to live long enough to get a kidney transplant.
Yes.
And I'm going to that bigger picture that Dr. Mensah wants to talk about, and I'll get the thoughts of Kwame Sapasudu to that too. What happened to that solution?
Yes.
The actual solution of getting the transplant in Ghana. What's the challenge there?
The challenge is the money. You see, if I'm to calculate the 10 years now, the money I've spent, I could have done transplant easily with that money.
Okay.
But the point is, I don't have the bulk money to go and do it. So at least then, if I get 1,000, then let me go and do a session and see if I can get money. And you see, day in, day out, day is running. So it's all about the money. So now, if this thing were there for the last 10 years, probably I could have saved enough, or the money that I have, I could have used it to do my transplant, and I'm off the dialysis.
That makes sense.
Yes. So that is the challenge. It's all about the money. Because now, Ghana, we are doing it. Kolebu is doing it. The Bank Hospital is doing transplant. We are doing it here.
But is it easy to get the kidney donated to you?
I'm happy Dr. Mensah is just up. We talked about that one today. Tissue organ storage box. We talk about at the committee. We talk about that one. We need to get it because now, for somebody to even to give his kidney to you, people are selling it. You know. People are selling the kidney. Yes, indirectly. People are doing it
in Ghana.
In Ghana, people are doing it indirectly. But normally you're supposed to get a bloodline, like your brother, your mother, something like that to get. But now, you know, the country is hot. People need money. So if I can live on one kidney, some people don't mind if they check.
How much are they selling it for?
Oh, some people are selling it maybe 3 million, 4 million Ghana cedis.
4 million Ghana cedis?
Yes.
Per kidney?
Yeah. Some people are doing it. You give it to you. You check. Once you do the labs and you are compatible, it's ready to give it to you. You give it to him. Somebody will say, oh, get me 2-bedroom apartment, let me go and stay. I'll give you one of my kidneys. It's there.
Wow.
Yeah, it's there because, you know.
So you buy the 3 million Ghana cedis kidney, and then you have to now go and pay for the procedure.
Pay, yes.
Because you're doing a story where this 13-year-old needs $25,000
yes.
for the procedure.
Yes.
Not the kidney, but the procedure.
Yeah, the procedure.
That's a lot of money in terms of...
That's what I'm saying. For 10 years now, if I'm to sit down, calculate even the erythropoietin injection alone that I have bought, the BP medication that I have bought, and I calculate that money, I could have done transplant way back. But because the money is not there, so you get 500, let me go and do dialysis. Before you realize the year has ended, and you are starting again. I have children, you have to take care of them, you know, in between.
But it's a very important point you make there, that if you want kidneys to buy, there are people on the black market who are selling it in Ghana right now. Kwame Sepasi, that's a big picture, and I know that that's part of the conversation that has been had. Now that the first hurdle has been crossed, making it free, there is a big question we need to have, which is what we just started having about the policy around kidney transplants and kidney donations, etc. I know that is something that you have talked about. Sarah is also talking about. What needs to happen now?
Well, we need to get a policy in place. My last check indicates that there's a policy that's at cabinet level at the moment. But this whole issue about tissue and organ harvesting and sale is a global problem. I mean, there is a case where a senator from Nigeria even is currently in jail in the United Kingdom because of, kidney harvesting for the daughter. So it's not a problem that is peculiar to Ghana. And it wouldn't go away unless and until we have policy in place. And the thing is, to have the policies in place, you also have to have modalities for people who unfortunately might lose their life in accidents and other things to opt in and opt out, because at that point they are not what we call compos mentis to take a decision whether the organs can be donated to another person. All that has to be factored in and all that. So the question is, how quickly can we get that done? But like Mr. Hinkra said, even if that is not done, and currently you can get dialysis for free, then there's an option to save, and even if you cannot get it in Ghana, you get it done in other countries, like India, where a lot of people go to. And that takes a significant burden off the head of the patients who are on renal dialysis. But for me, the answer is not in dialysis or transplant, it's in prevention. And I've always made the argument that the answer is in prevention, because there's primary, secondary, tertiary, and quaternary renal failure. If you cut renal failure early, nature has designed the kidney in such a way that sometimes it can repair the damage done to itself at a very early stage. The problem is that we are not catching these things early enough. And for me, that is where the two political parties were seeking power. I know Dr. Nsiasa is saying this wasn't about politics, but for someone who works in civil society and understands politics, any announcement that is made on a political platform has political undertones. Nobody can take that away from the way politics works, because you make a pronouncement on a political platform to get a political advantage. That is globally accepted. But that's fine as long as it benefits the people, because politics in itself is a social contract between the politician and the citizen to develop to deliver development. And part of development is healthcare, because healthcare is a public service good. So if even it's been made on a political platform and it's going to benefit people like Mr. Hinkra, I have no problem with it. But the question I ask is, how feasible is the preventative healthcare strategy for these two political parties, and how is it going to prevent the lives of Mr. Hinkra from going into chronic renal failure?
And that's one of the things that we highlighted the last time. I want to put that to Dr. Nsiasa. Dr. Nsiasa, your thoughts on that?
Hello?
Yes, Doc, your thoughts on that, the issue around the preventive care, but also the organ policy.
We have put that right now in the question. And the preventive health care starts with detection, early detection, and making sure that people who come to our wellness clinic. Hello?
Yes, I can hear you.
Hello?
I can hear you, sir. Dr. Nsiasa?
Hello?
I can hear you. Can you hear me?
Hello?
Okay, we may have a challenge with him there, but I can hear you. Can you hear me? Okay, he doesn't seem to hear me. But by the way, that's just wrapping up here. I'm pretty sure all of you are looking forward to December 1. Yes. Okay.
We can win.
Okay. And I need to ask you, will this influence who you vote for on December 7th?
That one, I can't disclose that one to you.
Okay. Well, Dr. Nsiah, we lost you briefly. You're back. You're making a point. Okay. Well, thank you very much for joining us. Dr. Nsiah, unfortunately, his line won't help us to give him a final word. But Commissioner Basiru, grateful as always, always great to talk to you. Enjoy the rest of your evening.